I never knew. It was my first time learning about Global Health Next Generation through you. When you contact me on LinkedIn, I was like, okay. Then I went to the website and had to see what is this Global Health Next Generation Leaders is really about. So I found it quite interesting. But honestly, it was you. It was through you knowing it for the first time. I'm a registered nurse. I'm also a midwife. I've been in practice for 9 years now as nurse and midwife. Currently, I'm working as a maternal and child health nurse lead. So my primary role is to do mentorship as well as quality improvement projects as regards to maternal and child health. I was also privileged to be selected as a member of World Health Organization Primary Health Care Network. That was in 2018. So I'm still part of the team, part of the network. So we are advancing primary health care in our respective countries. We are 21 of us. So the terms basically is to just share experiences and see how these can influence or other settings. So sometimes partly I am involved with the primary health care department in my country. So I'm part of, I become part and parcel, maybe forming some policies and guidelines as regards to primary health care. So they involve me here and there sometimes. So I'm a nurse and a midwife. So basically I'm much into practice. The experience that I'll talk about is because that's, I think, to me, that always comes as the major highlight in my career path, being selected as a member of WHO Primary Health Care Young Leaders Network. So basically, the secret was to really understand what they really wanted. So they were looking for young health professionals who have been greatly involved in primary health care in their local context. So I looked at the questions. So they were essay questions. So I looked at the questions and I had to understand what is it that I'm doing that will make me be selected. So I think it's about understanding the questions or getting to know what they're really looking after and see how you fit in there. You look at your experiences, your everyday jobs, and how are these two relating and also matching with what they want. So I found it quite easy because it was pretty much what I'm already doing right now in my country. So I work in a very remote area where it's hard to get to town. So the environment is quite challenging. So I took those as strength to me. So I like I said, it's about looking at what are your highest points or the things that are making you match to the applications that you're working on. If you find that they're really matching with your current roles, that becomes is very much for you, because it's more like you're just telling your story and you're not trying too hard to fit yourself in that position. So I'm working on going bigger within global health. So currently, as a nurse, as a midwife, this is the path that I took. What I'm doing every day is exposing me on how I can influence decisions, policies as regards to nursing and midwifery. So I find it quite quite fulfilling, and I think I'm getting there. Because at the end of the day, I think what we all need is the exposure to get us where we are. And I have that exposure, and I'm grateful for it. And this will take me to where I want. I'm into volunteerism, outside work. I get involved myself with my fellow peers. So we are advancing education of the girl child as well as their health, especially the young ones and the adolescents. So on voluntary basis, I'm a board member of a youth-led community organization. It's called Center for Women and Girls Empowerment. So as the name says, the focus is on the girls, and for girls is to advance them in their education. For women, those that are vulnerable, we help them. We give them tools, we give them skills on how they can live their normal lives day by day. So that's my interest as well, to improve that life of a girl child in rural areas who has no hope that they will make it in life one day. Because I consider myself as a role model. I come from the same settings, but I managed, through the help of my parents and other people around me, I managed to get where I am. So what I do is to help others also find their ways in either career-wise or just life and make it. It means understanding healthy care in an international and interdisciplinary context, either through research, study, or practice. One of the most prominent agencies is the WHO itself. We both know that they are there to guide policies on how individual countries can design, strengthen their healthy care system. But they have researchers, they have in a variety of disciplines driving the global health initiatives. So that tells me that global health initiatives take into account both medical and non-medical disciplines. So some people feel that if they are working for WHO, it means that is global health. But to me, I look at it as taking those policies, those guidelines that they give us, and putting them into a local context. That is global health to me. And much focus being put on improving their health as well as achieving equity for all populations worldwide. That is global health to me. I work in a rural setting. Some people, they call them hard to reach areas. I think what I find more interesting is that it is the type of stories that we bring, the type of the experiences that we bring or we voice out in whatever platform. It helps a lot to shape global health. And I believe I'm doing that, and I've been doing that ever since I'm listening and maybe train. So because like I said, it's about bringing those policies into your local context, and we know that there are a lot of influences or a lot of determinants of health, and one of it is access to care. In my context, access is a problem, and I work in an area where people really find it difficult to access healthy care sometimes. So those experiences, those lessons that I gather and bring to the table, I feel like I'm really making a difference, and I'm part of advancing global health. Because at the end of the day, we want healthy for everyone. And if we talk of healthy for everyone, it means reaching to those that cannot access care. Global health is broad, like I said. There are a variety of fields, a variety of disciplines. what matters most is to decide which area are you going to focus on. Is it through nursing? Is it through family medicine? Is it through policy? So, or surgery, or whatever discipline. So first you have to identify the areas that you are interested in, and then you find opportunities that are aligned with the area that you're interested in, and grow in that. Because it is broad, so there is no way you would be able to do everything at once. But you choose an area that you're interested in, and find opportunities to get you there, and then stick to that, and you make a difference within the group.